name is Gina Dryden, student nurse practitioner. How are you doing today?
I'm doing good.
That's good. Can you please tell me your name and date of birth?
Seth Dryden, 7/11/1995.
Thank you, Seth. Today we're going to be doing an assessment of your abdomen and your blood vessels. Is that okay?
Yes.
All right, we're going to go ahead and get started. I'm just going to have you lay on your back with your head on the pillow. So first I'm just going to do a visual inspection. Looking at his abdomen, there's no distension. It looks symmetrical. I don't see any masses, lesions, rashes. Noted. Can you go ahead and take a deep breath and hold it for me? Okay, no muscle separation. Go ahead and breathe. No hernias, no masses. I'm going to have you bring your head up into a crunch. Okay, go ahead and relax. Good. No muscle separation, no hernias, no masses. All right. And then I'm going to look from the foot of the bed. I'm just looking for any aortic pulsations, anything abnormal. I do not see anything abnormal. And then we are going to go ahead and auscultate his bowel sounds, starting with the right lower quadrant. Just breathe normal for me, Seth. Okay, good. His bowel sounds are normal active and the frequency is appropriate. I'm going to go ahead and listen to your liver and your spleen. Okay. Good. And then I'm going to auscultate his aorta, his renal arteries, his iliac arteries, femoral arteries. And no friction rub was heard on the auscultation of the spleen or the liver. All right, so what's going on here? Okay. Aorta. Good. Renal artery. Good. Left renal artery. Good. Right iliac. And the left iliac. Good. And the femoral. Good. All right. Next, we're going to do some percussion. I'm going to be tapping on your belly a little bit, okay? You're going to let me know if you do feel any pain. Any pain?
Nope.
Okay. All right. And then I'm going to press your liver and your spleen. Good. Okay. All right. And then it was dull over your liver and to panic over your spleen, which is appropriate tones. All right. Now we are going to percuss for the borders of his liver. There, and then we're going to start down here. Okay, we're going to go ahead and measure here, and it is 7 centimeters, which is within the normal limits of 6 to 10. All right, and then we are going to percuss for his gastric air bubble, which is going to be 5th to 6th intercostal space, mid-clavicular. So I'm going to go down here. till we get to tympani. I would say right there. Okay, gastric air bubble. It's appropriate. All right, and then I'm going to have you sit up. We're just going to assess for any kidney tenderness. All right, so I'm going to find it up. 11 to 12 rib. All right, and you're going to let me know if you feel any pain. Any pain?
No.
Okay, negative for kidney tenderness. All right, Seth, I'm going to have you go ahead and lay back down for me. All right, so we are going to start with palpation. If you do feel any pain, just let me know, okay? Just using my fingertips here. All right, all the quadrants palpated. It's soft, non-tender, no masses noted. All right, then we're going to do deep palpation. So this is where I'm using 2 hands. Okay, again, soft, non-tender, no masses noted. Okay, no hernias. And then we are going to, I did palpate the umbilicus, the umbilical ring. His umbilicus is inverted, looks good, non-tender, no hernia. And I'm gonna palpate the liver border. Okay, take a deep breath in and out. Any pain?
No.
Okay, good. And then I'm going to, I couldn't really feel it there, okay. And then I'm going to palpate for his, we're gonna do the Murphy sign for his gallbladder. Okay. Are you having any pain?
No.
Okay. Negative Murphy sign. Now we're gonna palpate his spleen. Okay, all right, I'm just gonna palpate and you're gonna let me know if you have any pain. Any pain?
No.
Okay, I don't feel the spleen. All right. And then we are going to palpate his kidneys. Okay, not feeling them there. Go ahead and relax. All right. I'm gonna feel for any aortic pulsations. Nothing abnormal noted. No masses noted. And that completes our abdominal assessment. All right, we're gonna go ahead and get started with our assessment of the blood vessels. All right, so looking at Seth's color, it is distributed evenly. I'm not seeing any peripheral edema. Hair looks distributed appropriately. His hands and feet look good in color. He looks like he's not having any venous insufficiency. Nails look good. They look healthy and strong. I don't see any ulcers, lesions, and I don't see any muscle atrophy. So we're going to go ahead and palpate his pulses, looking for rate, rhythm, contour, and amplitude. So carotid pulse. 2, 2. We're going to do his brachial pulse. 2, 2. Radial pulse. 2. Also a 2. And then we'll move to popliteal, kind of behind the knee here. Can you extend your leg a little? Okay, 2, 2. And then we have dorsalis pedis, 2, 2, post-tib, posterior tibial, 2, and a 2. Good. Those all are appropriate. I'm going to have you lay on your back, Seth. And I'm going to palpate your femoral artery right by your groin. Okay. 2, 2. I'm going to look up, looking for any aortic pulsations or anything. Everything does look good. Nothing abnormal noted. Okay. Now I'm going to auscultate his arteries. Start with the carotid. Good. Good. Okay. Abdominal aorta. All right, renal. Iliac. And femoral. Good. All are appropriate. All right. I'm looking for any, I don't see any jugular vein distension, any abnormal pulsations. Let me see. I am going to put another pillow under here for you. Let's do one more thing. I'm just going to look if I push on your liver. Can you turn your head to the other way, a little other way? Yep. And then just hold your breath for me. Okay. Okay, go ahead and breathe. Okay. Okay. It looks appropriate. And that wraps up our assessment of blood vessels today. Thank you.